We're so pleased to have you join us to think about the question, why should I become a nurse midwife? I'm Tanya Nicholson, the Associate Dean of Midwifery and Women's Health at Frontier Nursing University, and I am guessing that you're listening in with us today because you're considering this career path. You're a current student, or maybe you just need a reminder about the joys of midwifery. So as we share our stories, I hope you'll be inspired and encouraged. Somebody recently asked me if I had ever regretted becoming a nurse midwife, and my answer is and was and probably will always be absolutely not. I have been blessed, so blessed to talk to young women about their bodies changing and women my age about our bodies changing and have had the honor and the privilege to walk alongside women at their most vulnerable yet their most powerful times as they become mothers. I have not had one single moment of regret, but I have had a lifetime of thankfulness. So I'm blessed to be joined today by 3 certified nurse midwives and 1 student nurse midwife as we discuss the beauty of midwifery and the many paths that have led my guests to this wonderful, magical world of midwifery. I hope that you can identify with one of my friends here and their story. So let me briefly introduce our panel. So when I introduce you, if you'll wave your hand so everybody can put a face with a name. And then as we go along, they're going to share more about themselves. So I'm going to give just a little tiny brief introduction. Jessica Hinman is a certified nurse midwife, and she received her master's from Frontier Nursing University in 2010 and got most of her training at a busy birth center and home birth practice in Pennsylvania, primarily from Frontier Nursing University graduate midwives. She has lived in St. Louis for most of her adult life, and she has 3 wonderful kiddos, and she has a great story about what she is professionally doing right now. I'm going to let her share that in a few minutes. Latrice Martin. There's Latrice. Latrice Martin finished her career in the Air Force and then worked as a surgical tech as a civilian while she went to nursing school. She worked in labor and delivery while fulfilling her dream of earning a Master's of Science in Nursing and a midwifery certificate in December of 2009 at what was then the Frontier School of Midwifery and Family Nursing, which, by the way, was the name of it when I graduated a long time ago as well. Since graduating, she has worked in a variety of women's healthcare roles and is currently working at the only birth center in Nebraska, the Midwife's Place. She has a wonderful husband and 3 beautiful children, and the last one was born there at the birth center. Robyn Mchugh. Yay! Robyn is a recent graduate of Frontier. She actually graduated just this past June and passed her boards in July, successfully earning the title of Certified Nurse Midwife. She's currently working toward completing the licensure and accreditation process for birth centers at Missouri Mennonite Clinic. She remains employed at the same location where she previously worked as a registered nurse and a certified professional midwife. And our student, Kim Sampson, is a current nurse midwifery student at Frontier Nursing University. She is almost done with her studies. I think you said the other day just 40 hours left or so. Yay. And is excited to begin her professional career as a certified nurse midwife. She brings many years of experience as a labor and delivery nurse to her studies. So I think you see that we have a wide variety of backgrounds here, and that there was a method to that madness. Because what I'm hoping is that you guys that are listening can find something here to identify with to help you understand the joys, the obstacles, the strengths and that you bring from wherever it is that you currently are, and the understanding of how you can be successful. So one of the first questions that I often get from students is, I've got kids, I have to work, how in the world am I going to do this? And I know, Latrice, that you did it that way. Can you tell us a little bit about how you were able to do that?
Yes. So I was actually pregnant with my second child. My first child was 4 when I started my midwifery program. And just the main goal that I really want to be a midwife was just the driving force. And then I had supportive husband, and it helped that I was pregnant probably for the first half of school. And then I just, adjusted my hours a little bit once I had the baby. And then, once I got past the postpartum period, just kind of really kicked it back into high gear. But like I said, I had a supportive husband. I had my main goal of being a midwife in front of me. And so I think that's kind of what helped me. And then good time management.
Robyn, if I'm not mistaken, you were a single mother when you went to school. Is that correct?
Well, I do think that it helped that some of my children were older and we all pitched in. But the good part about that is I got to role model being a student and how much time it takes to be a good student for my children. And, sometimes we think of the negatives of what we're not doing with our family, but every family doesn't get to see their moms and how hard it is to succeed and to get somewhere in life. So in that sense, it was great.
Thank you.
They sit right beside me and do their homework too, sometimes.
Yeah, I came to Frontier after being a doula and a childbirth educator for 7 years. I had been a nurse for a long time, but had never worked labor and delivery. And when I was finding a preceptor, I asked my preceptor specifically, like, is that going to be okay? And she said, actually, I love that because I don't have to unteach you anything. So it's been great. Everything that I learned the midwifery model, not, I've been doing it this way as a nurse for 20 years. I can't, I have to stop myself from this. It was a huge change for me as far as role, going from doula, skipping all the way to provider. But my preceptor worked with me great, and I got a lot of really good experience and was able to slide right in. Yeah, I think a student without any childbirth experience could certainly complete the program and make an excellent midwife. I think the way Frontier has a wide variety of clinical experiences available all over the country, all sorts of different practices. I think finding the right site where you can get a variety of experience and have a preceptor or a team of preceptors like I had where they were able to really tailor the experience to me really helped. And when so I'm a preceptor for Frontier students now, and we definitely talk through that in the interview process. What's your background? Where do you think you have the most room to grow? What experiences do you feel like you need to focus on? And what do you think your timing is going to be? Do you think you need to kind of add in some buffer time to do a little more kind of warming up to the role before you start counting, primary births? But there's a lot of flexibility. I think people from a variety of backgrounds can do great with the program.
Well, let me preface this by saying I started in becoming a nurse because of the example that I had during one of my births. So that made me decide to be a labor room nurse. I was like, I'm going to go to school so that I can become a labor room nurse so that I can do and be the kind of supportive person that she was to me. So you fast forward that a few years, and I really wanted to become a midwife because I saw I just really wanted to be more with the woman. I was very supportive in my role as a nurse, but I kept seeing a lot of C-sections done at 5 because they just needed, doctor wanted to go home, and I felt like that wasn't necessarily the right way. And if I was going to help with the right way, then I needed to actually do something about it and become a midwife. And that it really became that, and the fact that I saw a really wonderful example in some of the midwives that I worked with, and they encouraged me and made me feel like, I had the skills to become a nurse midwife, and I just needed to get in there and do it and become it. Yes, and it was very, very, it's exactly how I feel. I didn't know all that I didn't know. I had a lot of experience, but it was all in the medical model. And, the medical model kind of makes you feel like childbirth is a dangerous thing. And I didn't know as much as I now do, having gone through Frontier, about how childbirth is a normal physiological thing, and if we let it be, 99% of the time it turns out beautifully. And we just need to be educated enough to recognize the things that need to be helped along, or changed.
Okay. So I work with Amish and Mennonite patients, old order, and I have ever since I became a Certified Professional Midwife in 2008. And they taught me normal birth, and they taught me to be comfortable with the process and to be with the woman. And I think that part of the equation that I was lacking was every once in a while we have complications where we do need to know those medical skills. So there was a birth that I attended at the beginning of my CPM career where the birth went fine, but after the birth was the problem. The mom ended up having a complication and needed surgery. She had a placenta that had ingrown through the uterine wall, and I got there and had no respect from the medical model, and mom had a bad experience and luckily was okay at the end of it. But I had to come to Jesus meeting with myself, and I thought, if we go to another country, we learn the language. And the language is nursing and medicine in those complications, and I needed to build a respect between providers so that if a mom needed something more than me, because every once in a while we need to pass the baton on to other providers when we're not all a mom needs. And so I really felt like going back to school was that answer for me. It kind of fills in that equation, and it's taking that next step in order, whatever the mom needs, that's what I wanted to be. Wherever she needed to be, that's where I wanted to go. So,
Latrice, to talk a little bit about being a midwife of color and what you think that means and why you feel that's important.
Okay, well, I think it's important because when you see someone that, looks like you, probably has a similar background and kind of upbringing and as far as the culture, then you kind of know maybe where they came from, and they know that you probably may understand where they've been. And with us having the disparities that we have, I think we need more women of color to help our culture. Not saying that any other culture we can't help each other, but I just think it is something to see someone that looks like you that's going to be assisting you and is professional. I even have some clients at the birth center that she sought me because I was African American, and she said that she wanted to support me, which I found was an interesting statement. Even though I'm going to be serving her, she felt the need to support me, and as far as me being African American, and I just was honored by that. And just I'm also a lactation consultant, and I'm trying to work with our community and getting that up and going, and getting our women outside of that culture of, going straight to the formula, and that's all, a lot of us African Americans have seen, just go straight to formula. And I didn't really see much breastfeeding growing up. And so just promoting that and just kind of being there with the women. And I think that is important, just for any culture, any minority culture. I think you have a tendency to kind of gravitate towards each other and want to support each other. So I think it's very important.
I want to give everybody the opportunity to just kind of tell a little bit about what you're currently doing, and or either or both, like your favorite birth story. Just what's your favorite? Give me a quick favorite birth story.
Well, one specific one comes to mind, and that is because of the big difference between how I used to practice and how I feel like I'm going to practice now. And essentially, it was one of the very first births that I did, And just to make a long story short, she was trying to go natural without any Pitocin, without any pain medication. And I was doing my best to encourage her. And essentially, she just got to the point where she started to feel like she really wanted to get an epidural. And I said, this is, you can have an epidural if you really want it. I'm not going to not let you have, but I know what your goals are. I know what you said you wanted to do, and try this first. And I had her stand up, and I had her start dancing with her husband next to the bedside, and about 30 minutes later, we had a baby. So, it was a very supportive and very encouraging experience for me, because up to that point, my general experience had been, lay them, position them in the bed, that everybody got an epidural, yada, yada. So this was very encouraging to me that, yes, indeed, this process works.
Well, so I work with Mennonites and Amish, and I guess I'm just going to tell you the last story, because every birth story is the best birth story. And so a few days ago, we had a mom that gave birth quite far from the clinic, and she lives way out on a ranch with lots of acreage. And I had told her in the beginning I could only do a home birth for her and not a clinic if it didn't seem like anybody else was doing anything. And I had another nurse midwife who went to Frontier that kind of backed me while I drove to her house, which was 2.5 hours away. Anyways, she put music on and had worship, and baby came beautifully, almost in the call. The water broke just seconds before the baby came, and baby was so alert, and mom and dad were so excited about this new little one. And then the other children that I also delivered came running in shortly after and came to see their sibling. And I think it's just exciting to serve families and see that same mom have the next baby and the next baby, and get to watch that family enlarge and the siblings interact. It's so exciting and fulfilling. So.
But I don't know, I think I have a special place in my heart, because for those moms that maybe had an epidural the first time, and then now they're seeking, a midwife to kind of have a more supported and medicated birth. And just because that was me, my first 2 were epidurals, and finally had like that one, unmedicated birth myself. And so I feel like I'm like a champion for them. So we did have a mom. We deliver in the birth center and at the hospital, so we have kind of both of those. And we just had a first-time mom, young. Her and her husband. We originally we were inducing her due to gestational hypertension. And so, we did Cytotec, a couple of doses, and we had agreed, we're just going to, everyone's going to take a nap. We're going to, reconvene in the morning, start everything back up. And then I got a call like at 1 o'clock in the morning, and they were like, I think she's ready. And I'm like, really? And so we go in, and I was just standing next to the computer, and she was swaying with her doula. And all of a sudden she was just like, oh my God, there's that. And I was like, okay, this first time mom, I think she's like 21. It was so wonderful that she was able to experience that. So, like I said, every birth is great, but special place in my heart is for those moms that had epidural at first and then now had a successful unmedicated birth.
Well, I'm going to sound redundant, but usually when people ask me, it's whatever birth I had that day, a lot of times. My practice, I get to do home birth and birth center birth and hospital birth. We've been able to practice in the hospital for about 18 months, and for St. Louis, that's a really big deal. There were no midwives practicing in hospitals, and so we're just getting to introduce moms to that idea that even if I don't have the low-risk, completely normal pregnancy and birth, I still get midwife care. So like yesterday, we have our first set of twins born in the hospital that were getting collaborative, and it was like the absolute definition of collaborative care. Our physician saw her son. We worked with MFM. You know, obviously it was a all hands on deck at the hospital. So that type of birth is amazing because it's, wow, even these women that you know, the general public might think midwifery equals no technology, no anything, you know, and here this mom needed a lot of close watching, testing and different things, and she was still able to have a midwife. But then one of my favorite home births was just kind of one of those once in a lifetime sort of coincidence things, but we had a 15-year-old come to us unexpectedly pregnant, and there was a family in her life who, due to cancer in the woman, was unable to have children. And this 16-year-old girl decided to bless this family with being able to raise her baby and made an adoption plan for her baby. But at the age of 16, she wanted a home birth, which is amazing. We love that more young women and more first-time moms are finding the information and finding midwives for their first experience. So this young woman wanted to have a home birth, and it was decided that the birth would take place at the adoptive family's home. And I love it. To occur on Christmas Eve. So,
wow.
So nobody had a dry eye. It was amazing, miraculous. You know, this young woman did a great job, and what a gift. You know, she got to be really cared for and loved through a very unexpected process for her, and she turned it into something that was more beautiful than any of us could imagine. So that was a pretty great day.
I'm going to ask you to tell me one by one, if you could tell somebody considering becoming a midwife whether you would do it again and why, what would you say?
Well, I'll go first. 100% yes, I would do it. I came to midwifery kind of a roundabout path, but it's better than I could have even imagined. You know, the relationships that I get to have with women, and, you know, seeing women transform during their births and discover themselves, it's worth all the crazy hours and, you know, and also the relationship I have with the team of midwives in our collaborative position. I can't imagine having that type of relationship with any other coworker because what we do is so intense. So, yeah.
I'll go. So, absolutely. I don't think that there's another profession on the planet that can even come close to being a nurse midwife. It is the very best profession there ever was. And, you know, we talk about empowering the women, but they empower us too. Their stories are amazing, and every woman we serve is just beautiful in her own way, amazing in her own way, and we get to bear witness to that, to some of the most amazing, intimate, special moments of women's lives. And I am not the person that I was before I went on this journey to become a midwife. So, yes, we learn a lot in textbooks and a lot from our faculty, but we learn most from the women we serve.
Well, I have yet to be a midwife, but I cannot wait, because my experiences so far in clinical have just given me so much joy, just watching and helping these women. And I just feel like this is the thing that I needed to do. I have found what I want to do, and I want to do it for the rest of the time that I work. I think that it's wonderful, and I just can't wait to get started to do it.
Well, I think everyone has said it graciously and probably better than I could. So I guess I want to go more of the angle to encourage whoever's listening and to re-listen once you are going through clinicals and going through school and deciding, did I make the right decision? When you have those challenging times, to know that, as you heard from every last one of us, we would not do this again. We would definitely continue with the program and become midwives. And I think we just want to encourage you to do the same, and you'll find the same joys that we have.
Thank you. Yes, I agree with all of you. I would do it again and again and again, like Groundhog Day. I would choose to do it over and over and over. So I'm so thankful to have a career like this, and so thankful for colleagues like you guys. And for those of you who are listening, we hope to see you on the front lines of midwifery school, and then as a midwife at the side of women. To walk alongside women on their journeys through life is an absolute amazing and magical thing. So come join us in the world of midwifery. Thank you.